Hello, and welcome to this training on the mental health benefits of mindfulness. My name is Heather Yasick, and I'm a licensed mental health counselor and founder of mindfulnessinvivo.com. The goal for today's talk is to provide some education and awareness around how the mind works in order to respond more skillfully in times of emotional distress. So, whether that's stress, anxiety, depression, insomnia, etc. So I'd like to actually get started by sharing a little bit about myself and my own journey towards mindfulness. So here is a picture of me doing one of my favorite yoga poses. I am a yoga teacher, a Zumba instructor. I'm really passionate about performing in musical theater, and I've always been a mover and a dancer. Well, a couple years ago, I sustained a really painful hip injury that resulted in chronic pain. So a dull ache that just was not going away. And I had seen chiropractors, physical therapists. I was seeing an orthopedic specialist at one point, doctors, nurses. And no matter what I did, I just couldn't seem to get rid of this hip pain as a result of the injury. And what I found was that what was worse than the actual physical sensation of pain in my hip was all of the secondary mental and emotional distress that came along with it. I found myself having a lot of thoughts like, will I ever be able to perform again? Will I be able to do Zumba again? I have a really active family, and I remember thinking a couple summers in a row, gosh, will I ever be able to keep up with my family on summer vacation? And so, luckily, one of my physical therapists was really progressive, and she recognized that I was having a lot of mental turmoil in response to my physical discomfort. And so she suggested that I start doing some kind of relaxation training, some kind of stress management training. And I had studied meditation and had studied mindfulness in an academic sense in college and in grad school. And so I knew that there was some clinical, empirical evidence to support that it was effective for both chronic pain and stress management. So I figured, all right, let's start there. I've done literally all the things that I could possibly do on a physical sense to treat my pain. Maybe it's time to switch up my game. So I started Googling, or I started looking up free YouTube videos, just, 5, 10, 15-minute guided meditations. And what I found was that in a remarkably short period of time, not only did my mental chatter start to quiet down, so those thoughts like, will I be able to dance again and do Zumba and keep up with my family, but remarkably, my physical pain eventually evaporated. And it really piqued my interest in both the relationship between the mind and the body and also how mindfulness can be a powerful intervention for both. So that's really where my personal interest in mindfulness began. And so I think before we move forward, it's important to define what mindfulness is. The best definition I've come across was introduced by a man named Jon Kabat-Zinn, and he's largely responsible for pioneering mindfulness in Western medicine. And he defines mindfulness as paying attention on purpose in the present moment non-judgmentally. And so another way of thinking of non-judgmentally is maybe self-compassionately or compassionately. And mindfulness can be divided into kind of two general categories. There's formal mindfulness, which is what most people think of. It's a traditional sitting meditation where you sit and follow your breath, or maybe you're lying down and completing a body scan. And then there's also informal mindfulness, which is just bringing the skills of mindfulness, so that intentionality, that compassionate awareness, and awareness of the senses, to everyday activities like folding laundry or washing the dishes. So when I give talks, I like to say that formal mindfulness is kind of like going to the gym and doing your heavy lifting and going to your cardio classes. And then informal mindfulness just includes those daily activities that support wellness. So parking the car farther away and walking, or taking the stairs instead of the elevator. And I think it's also important to define what mindfulness is not. Mindfulness is not shutting out your thoughts. It's not inducing an out-of-body euphoric state, And it's not a religious endeavor. So I think sometimes when I'm giving workshops, folks have a little bit of resistance around trying mindfulness because they're afraid that it's going to conflict with their religion. And I think this is because the practice of mindfulness is rooted in Buddhist teaching and Buddhist philosophy, but the actual practice is spiritually neutral in and of itself. It's really just a form of mental training. And so it's not a religious endeavor, although many people find that as a result of continued practice in mindfulness, they're able to be more present for their faith tradition of preference. And so actually, a lot of people find that mindfulness improves their spirituality, even though it's not a spiritual or religious endeavor. Mindfulness has been researched and has been found to have many benefits across a broad spectrum of both psychiatric and also medical conditions. And so, just a couple highlights: mindfulness has been shown to improve mood and energy, self esteem, creativity. It's been shown to promote productivity in the workplace and in schools. It's been shown to improve memory and concentration, which can be particularly helpful in the geriatric population and for folks who are starting to experience early stages of Alzheimer's symptoms. There have actually been some interesting studies that show that the regular practice of mindfulness lights up areas of the brain that are associated with empathy. And so it kind of suggests that the regular practice of mindfulness actually makes us more empathic. Mindfulness has been correlated with stronger, higher relationship satisfaction. In fact, I had a professor in college, in undergrad, who I remember he was teaching a psychology of marriage and family course, and he said, if you marry a mindful partner, you are in luck. He said, having a mindful partner is such a gift to your marriage. Its mindfulness promotes emotional resilience, so our ability to fight or to bounce back sooner after a trauma or a stressful event. It's been shown to provide relief from chronic pain, both the stress, the secondary causes of the pain, as well as the actual subjective report of the pain itself. And it's been shown to improve sobriety outcomes. And there has been an interesting area of research in the medical community looking at the effect of mindfulness practice on immunity. And so in addition to these improvements, it's been shown to reduce symptoms of stress, anxiety, and depression, reduce relapse, both from substance use and mental health relapse, and decrease irritability and other negative mood affects. So it comes as no surprise then that mindfulness has been used as a treatment, or at least as an addendum treatment, for a host of different psychiatric and even medical conditions, including stress, depression, anxiety, insomnia, PTSD, OCD, ADHD, eating disorders, and chronic pain. And from a medical perspective, it's been used as an addendum treatment to treat, again, chronic pain, fibromyalgia, hypertension, and there's actually been a growing body of research that suggests that mindfulness can be helpful in treating the stress and the mental health side effects of a cancer diagnosis and cancer-related stress. So considering all of these benefits, it begs the question, well, why is mindfulness so effective for mental health? And the answer is because it addresses mental health on two levels, both the psychological, so having to do with our thoughts and emotions, and also on the physiological, having to do with our brain and our body. So on a psychological level, what we know is that we are vulnerable to destructive thought patterns and triggering emotional states of which we are not aware. And so mindfulness helps us recognize and regulate triggering emotional states and thought patterns. And on a physiological level, mindfulness creates structural changes in the brain and physical changes in the body that promote the body's relaxation response, which can help mitigate the effects of stress in the body. So in order to kind of understand this a little bit more thoroughly, I think it's really important to look at the evolved brain. So this is Joe Schmo Neanderthal. let's say he's walking through the forest and boom, a lion pops out of a bush. So this is a real threat. He is in the presence of a real actual lion. So Joe Schmo's alarm system goes off in his brain and it sends signals to his body that, hey, buddy, you're in danger. You better either fight this lion or get the heck out of there. So let's say that he successfully removes himself from the situation, and that night he's roasting a tender morsel by the fire, and he just has a memory of, ugh, hey, remember that time earlier today when I fought off that lion? So in this instance, it's just a memory. The lion isn't actually there. So there's no real threat. It's just a perceived threat. Well, what we know is that Joe Schmo's same alarm system signaling to his body that he's in danger will fire off. And so he has the same physiological symptoms that he would in the presence of the actual real threat. So again, it's important to acknowledge that we can be triggered by a real threat and also by a perceived threat. So that could be a thought or a memory or even just a feeling. There's actually some evidence to show that people with depression can be triggered by their own internal sensations of depression, like a heaviness in their chest or a tightness in their eyebrow. So anyway, we experience a trigger, whether it's real or perceived, and the body's fight or flight response kicks into gear. And the first to respond to the scene of the action is the amygdala. And this is an area of the brain, it's a very primitive area of the brain that's responsible for emotion regulation and survival. So the amygdala sends a signal to the hypothalamus, which is kind of like the brain's command center, and it sends messages to the body about how to move forward in any given circumstance. And so the hypothalamus sends a message to the body that, hey, all is not well. So it starts pumping epinephrine, adrenaline, and cortisol through the system, and this results in an elevated respiratory rate, heart rate increases, maybe our digestion shuts down, and our senses sharpen, all in an effort to either fight the threat or flee the threat. And also interestingly, we start having thoughts that focus on survival. So we're very interested in solving the problem, getting from point A to B, and our thoughts tend to fall into either or categories. This is also called black and white thinking in the counseling world. And this makes sense. From a survival perspective, if you're in the presence of a real threat, there's not a lot of room for ambiguity. Either you fight the threat or you flee. Either I smash his head with a rock or I climb that tree. So there's not a lot of gray area. Well, all of these stress hormones pumping through the system, in the state of an actual real threat, these are put to good use. So they actually give our body the energy that it needs to either protect itself, either by fighting or fleeing. But what we know is that when we're not in the presence of a real threat, these stress hormones actually build up and cause a lot of inflammation in the body. And then the amygdala, our trusty amygdala, ever sensitive, ever primed for survival, picks up on this inflammation and says, something's not right. And it actually ends up re-triggering the whole system. So the whole cascade of the stress response gets triggered again, and it becomes a vicious cycle. This is just a picture of the fight or flight response. So the important takeaway from this is that our brains can't distinguish between an actual threat and a perceived threat. And in fact, this chemical chain occurs so quickly that the brain sends signals to the body before we've had time to fully visually process the trigger. This is why if you're standing on a sidewalk and you're able to dodge out of the way of a bus coming up behind you, you're able to sense that coming behind you before you're even able to visually process, oh, that was a megabus. So we are largely unaware of the activation of the sympathetic nervous system, that stress response, in our bodies. Left unaddressed, stress begets stress. So let's bring this home in a concrete example. An all too common example, which is that of insomnia. So this Poor soul here is just finds himself tossing and turning one night, just can't get to sleep. Maybe he's not really sure why, just for whatever reason, he's just kind of not really able to wind down, not really able to get to sleep. Well, so maybe his thoughts are spiraling around something like, why can't I sleep? What's wrong with me? And if he's having those thoughts, he's likely to be feeling frustrated, agitated, maybe a little bit wound up, or even self loathing. And if he's having those feelings, then his physiology is going to respond accordingly. Maybe some of the symptoms of that fight or flight response kick in, and he has dysregulated breathing. Maybe he's holding tension in the tongue and in the face. And behaviorally, he's tossing and turning around. Something just isn't quite right. Well, thanks again to our trusty amygdala. This sends signals to the brain that all is not well, and that reinforces the thoughts like, I'm going to be so tired tomorrow, I won't be able to get any work done, which makes us feel even more frustrated, more agitated, more wound up, and more self-loathing, which again reinforces the physiology, which reinforces the thoughts, which usually boil down to something like, I need to relax. Why can't I relax? I just need to relax. Am I relaxed yet? And you get the idea. So let's look at another example, and this one might be a little bit more subtle. So in this scenario, John is walking to his car on a sunny day after work. And maybe he's just he notices the sun outside, but he's just not feeling very Pollyanna-ish. He's just kind of feeling meh about life. And so he has a thought, why aren't I happier? Gosh, it's a nice day. I should be able to enjoy it. And maybe some feelings resulting from that thought pattern would be feeling irritable, disappointed, angry, self-loathing. And if he's having these feelings, his physiology is going to respond in a similar way. Maybe his breathing is, again, dysregulated, holding tension in the eyebrows, jaw, and posture. And he's more likely to withdraw and stay inside. Well, if that's the case, this is going to strengthen his thought that all is not well. So maybe he starts thinking, I'm such a bum. Gosh, no one wants to be around me when I'm like this, which exacerbates his feelings, exacerbates the physiology, and ultimately ends in some kind of thought like, I need to stop thinking this way. Stop thinking like this, which results in even more irritability, even more disappointment, even more anger, even more self-loathing. You get the idea. So what do these two scenarios have in common? The guy with insomnia and the guy with depression. Well, the first thing is that they both are experiencing resistance to the perceived threat. So resistance to the thought itself. In the case of the guy with depression, he's saying, I need to stop thinking this way. And the guy with insomnia is saying, I just need to relax. I need to stop thinking this way. I need to relax. So there's a resistance to the perceived threat. And also, there's a resistance to the present moment. So in the case of the guy with insomnia, he's resisting the present moment by saying, oh no, what about tomorrow? He's future tripping, as it's sometimes referred to. And the guy with depression is saying, why wasn't I happier a minute ago? Gosh, what's wrong? There's a resistance to the conditions of the present moment. And so if this is the issue, 1, resistance to the perceived threat, and 2, resistance to the present moment, then this is the remedy. Allowing the thought to be there and anchoring ourselves in the present moment. So on a practical level, what this might look like with the guy with insomnia is when he notices himself having those thoughts like, why can't I sleep? What's wrong with me? He can respond by recognizing it. Aha! I recognize that I'm having these thoughts and feelings. They're already here, so they can stay for a while. That's the acceptance part. They'll go eventually. For now, I'm going to invite my awareness to my breath. That's the part that's anchoring him in the present moment. And the breath and body, any of the physical senses can be a really strong anchor into the present moment. And it's an important tool to be able to implement because our awareness can only focus on one thing at a time. So, inviting the awareness to the breath or body or any of the senses anchors us in the present moment and reduces the mental chatter that results from the triggers. So, an important takeaway is that it's not our thoughts, moods, or sensations that get and keep us stuck, it's our resistance to them. Carl Jung put this really well, very concisely. What you resist persists. And boy, is that true. So, resistance hurts us on two levels. On a physiological level, when we're resisting something, we're creating more tension, and that leads to more pain. On a psychological level, resisting thoughts, memories, or sensations actually creates rumination. So, I want to do a quick exercise. So, go ahead and close your eyes, and for the next 15 seconds, I want you to try your darndest to not think about a pink elephant. So, in your effort to not think about a pink elephant, which you're definitely not thinking of, you're probably trying to avoid all thoughts of the zoo, the safari, your 3-year-old niece's birthday party, which was elephant themed. You get the idea. So, in trying really hard to not think about a pink elephant, how did you do? If you're like most people, probably not so well. So, what we know is that when we're trying to resist a certain thought or memory or mental event, we end up making it worse because we're calling to mind the very thing that we're trying to avoid. And I know this is kind of a silly example with a pink elephant, but you can imagine the implications this can have for someone with, for example, post-traumatic stress disorder. In this disorder, maybe someone is strongly triggered by certain sounds or smells or places, and they experience really disturbing images, sensations, feelings in response to these triggers. Well, so if they're operating in the world constantly saying, oh, don't think about that thought, or don't remember that memory, or don't go to that place, or don't smell that smell, you can imagine how stuck and powerless a person can feel. So, this is where mindfulness comes in. Again, mindfulness teaches us how to pay attention on purpose in the present moment, non judgmentally. And on a physiological level, brain scans show that regular mindfulness training reduces activation of the amygdala, so that little red light bulb, that first responder in the event of a stressful event. And so it actually reduces activation of the amygdala and increases prefrontal cortex functioning. So the prefrontal cortex is considered a more evolved area of the brain. It's more towards the forehead on your actual face, and it involves things like planning, prioritizing tasks, decision making, problem solving, concentration, higher executive functions. And studies also show that regular mindfulness practice improves emotional resilience. We're able to bounce back faster after a distressing event, so that we can bypass this cascade of stress response before it really gets out of hand. This is just a picture of the animal brain and the prefrontal cortex. So that more evolved side of the brain on the left side includes decision-making skills, planning, problem-solving, concentration. And the animal brain, which includes the amygdala, is really just focused on survival. It's all about keeping you alive. That's where Joe Schmo Neanderthal lives. And this is where Jake the executive lives. So it makes sense then that mindfulness serves as both a prevention as well as an intervention for distressing states. A good way to remember this on a practical level is to remember these two acronyms. One is to take care of your pet, and two is AAA. So taking care of your pet, PET, stands for posture, facial expression, intention. And I'm sure as soon as I said the word posture, you lifted up a little bit higher in your chair. And it's actually really important. Studies have shown that posture and facial expression are actually hold more tension in patients with depression and anxiety. And so, as one of my favorite mindfulness teachers says, a soft body is a very good way to soften the mind. So, a really good place to start is to sit in a dignified posture, one that's not overly hunched over, but also not overly rigid, and soften the facial expression. Kind of check in with, okay, what feelings, what tension am I holding in my face? And then also just bring awareness to any other areas in the body where you're holding tension. Softening the body can be a really powerful way to soften the mind. And then when you notice yourself getting caught up in that ruminative thought cycle, remember triple A. The first A is awareness of the thought. So, okay, I'm starting to recognize this thought pattern. I'm recognize that I'm having a thought, and I'm having some resistance to it, which takes us to the second A, which is accepting the thought as a thought. So, accepting the thought does not mean that you're endorsing the content of the thought. It just means that you're noticing, okay, it's here. It's already here. So it can hang out. This thought can just be here for a couple minutes. It'll go eventually, rather than resisting it. So rather than trying to argue your way out of it or suppress it and push it away or ignore it. And then the third A stands for anchoring in the present moment. And that's where any of the senses can come in really handy, or also just focusing on the sensation of the breath down in the abdomen. There's a great quote that states that depression is living in the past, anxiety is living in the future, peace is living in the present. So, what does this mean? Regularly practice mindfulness in order to decrease baseline stress levels and increase skills of resilience to stressful events. And become aware of your own triggers. Those could be thought patterns, moods or feelings, physical sensations, and your resistance to them. So that, instead of all this junk, aha, the light of awareness can give you empowerment and enlightenment. So just some practical tips before you actually embark on a mindfulness practice. It's important, once again, to use upright posture. And that's actually, there's actually a really specific clinical reason for that as well. So there's an important nerve that's involved in the parasympathetic nervous system, so the body's relaxation response. And it's called the vagus nerve. And what we know is that when we sit in an upright posture, this kind of streamlines communication between the brain and the body. It kind of keeps communication lines along the spine nice and open, versus if you're really hunched over or overly rigid and holding unnecessary tension, that can kind of like cramp the nerve and cramp communication between the brain and body. So sitting in an upright and dignified posture actually will help you relax the body and also have stronger concentration. Again, it's important to relax the face. We hold a lot of extraneous tension in the face. It's a really a very evolved set of muscles. We're able to, many of us are able to kind of tell someone's mood instantaneously just from the expression on their face. But the converse side of that is that we hold a lot of tension in the muscles of the face. And so if we can relax the face and practice softening the muscles around the face, this sends a calming signal to the body and to the brain that all is well and we're good, and that can help invite in the relaxation response as well. During meditation, whenever you find the mind wandering, gently bring it back to whatever the object was without judgment. So something that comes up a lot when I teach workshops is I'll lead a guided meditation, and someone will find that they get really distracted by the physical sensation of pain in their body. And so what the recommendation is if you're in a meditation and you notice that the mind has wandered, whether it's to a region of intensity or pain, or it's just off on like what you're gonna eat for dinner that night, Acknowledge where the mind has gone to and then gently bring it back. And it can be helpful in the case of pain. It can be helpful to acknowledge where the mind went to and then also maybe just pay attention to your emotional response to it. Do you have a lot of mental chatter that comes up in response to your physical sensation? And then invite it back to the body or back to the breath or wherever you'd intended it to be. I think it's important to start small. So maybe that's 1 minute, 3 minutes, 5 minutes a day. And if it seems like something that's helpful, increase it from there. And at the end of the day, remember that we're practicing the skill of acceptance. So whatever comes up during the meditation can come up. There's space for it. It can become a part of the practice. So in summary, our bodies and minds have a complex feedback loop. We often resist certain thoughts and moods as well as the present moment, which causes tension and perpetuates a vicious cycle. Mindfulness helps us recognize triggering states and mitigate the resulting stress. And mindfulness can be practiced anytime, anywhere. So let's have a little flavor of that just for the last couple minutes of this presentation. Go ahead and find yourself in a comfortable position. Using that upright posture, finding a dignified lift in the spine and allowing the muscles of the face to be soft. And opening the eyes and allowing the gaze to pan the room and just take in your surroundings. Having a real sense of being right here, right now. Taking in the shapes and the colors of your surroundings. And now allowing the gaze to rest on one object. It can be anything. And taking a moment to silently ask yourself the following questions. What is this thing? What shape is it? What color is it? What's it made of? And allowing the gaze to once again take in the broader surroundings around you. And after a moment, finding another object and allowing the gaze to rest there. Again, asking yourself, what is this thing? What shape is it? What color is it? What's it made of? We'll do this one more time. Opening the awareness to take in all of the surroundings. And at a certain point, settling the gaze on something. Asking, what is this thing? What shape is it? What color is it? What's it made of? And taking a nice deep breath in through the nose down to the abdomen, filling the belly, and letting it all out. This is a simple grounding exercise that can help settle the awareness in the present moment. And it also invites activation of that prefrontal cortex, those more executive functioning areas of the brain that can be involved in tasks like concentrating, prioritizing tasks, planning, and problem solving. So I encourage you to use that the next time you're maybe losing your awareness or attention in a meeting or at work or when you're standing in line at the grocery store. It can be a really helpful touchstone just down into the present moment using the sensation of sight. I want to share a couple quick resources with you. Mindfulnessinvivo.com is, of course, my website. Franticworld.com is also another great resource for guided mindfulness practices. If you're looking for a good read that's a really great introduction to mindfulness and its benefits for mental health, I strongly recommend that third one down, Mindfulness, an 8-week plan for finding peace in a frantic world. That's a great book. Thank you so much for joining me today in this training on the mental health benefits of mindfulness. I strongly encourage you to take some of these practices and implement them into your life starting today.